Good evening, today is May 29th, and today I'm continuing to be talking about the coronavirus. So the first piece of news is that experts believe that it will be a long time before herd immunity is reached. Herd immunity is when most of the population is immune to disease, and as a result, those who are immune can protect those who cannot be immune, such as newborns who can't receive vaccines. London, Madrid, and other cities of the world have only a small fraction of the coronavirus cases needed to achieve herd immunity, according to new studies. Experts also believe that herd immunity is reached when between 60 to 80% of the population, and even in New York, the city with the world's highest known infection rate, is barely a third of the way there, according to studies. This also shows how that it may be a long time before we can truly reopen, as we need the most of the population to be immune before we can reopen safely and make sure that no new coronavirus outbreaks will occur. The new studies also have given us an idea of the vital signs of a vaccine, and many experts believe that with a vaccine we can achieve herd immunity. You can look at my previous videos on vaccines to learn more about it. The second thing that I'd like to talk about is that there are going to be big changes coming into the workplace, and corporate workers may barely recognize the offices they return to. The Center for Disease Control and Prevention, or the CDC, has made sweeping new recommendations on preventing the coronavirus from spreading in workplaces. While the advice covers the basics like daily temperature checks and face coverings, as well as issues like ventilation with more open windows, the agency also offers some advice that might not be very feasible and could be costly for companies who are already slashing their budgets. As a result, some employers may decide it's simply easier to continue working from home, and companies such as Twitter have already said that it may be say that workers may work from home forever. Other companies have said that they found the recommendations to be feasible, and it could be done. However, other company workers are simply worried that, and employers are worried that if they conduct the recommendations from CDC, including social distancing in the workspace, then there will be reducing the density considerably, and the remaining workers or furniture may not work in a small amount of space that is provided. While there are many solutions, these often require substantial thought and a budget that likely doesn't exist, and many companies are just deciding that it should be down to the workers themselves, and that if workers decide to work from home, the companies can support this, and if workers decide that they can return to work while following the recommendations, including wearing a face mask covering and practicing social distancing, then it may just be down to, then they could do it as well. The third thing that I'd like to talk about is that there has been a transmission mystery in which scientists don't know how much exposure to the coronavirus is needed for a person to become infected. Predictions have also proved to be extremely tricky because the coronavirus behaves so differently from the other viruses, including the influenza and MERS, which are very similar. It mostly depends on how much of the viral particles that you have come in contact with, not the exposure to it, and often the more particles you come in contact with, the more of the virus that you will receive and you might get sick. However, the coronavirus behaves differently as there are so many factors in which, while it usually is the fact in that people with more severe symptoms will spread more of the disease, but that is not the case with the coronavirus. And and the shape of the receiving end of the person's nostrils and mucus in their nose may also affect this as well. The dose of the particles may also vary from how it is done, and many times it may be different whether it's ingested or inhaled. And some people are considered strenuous transmitters, spreading extreme numbers of the viral particles, while some are not. So these are just a large mystery surrounding how the coronavirus is spread, and more studies are being conducted as we speak. So I think that to understand more of the virus, we can understand more how to treat it and how to prevent it from creating outbreaks. That's it. Thank you for listening, and I hope you have a good day. Thank you.